Good evening, everyone, and welcome to our webinar titled Social Anxiety, How to Help Kids Who Won't Join In, hosted by Morneau Chappelle Children's Support Solutions. My name is Samantha Herberman, and I'm a behavior consultant with Morneau Chappelle, and I'm happy to be the moderator for this evening's webinar. As your moderator, I'm very excited to take you through what the next 45 minutes will bring. I will walk you through our agenda for this evening, as well as some housekeeping pointers, and then turn it over to our wonderful presenter, Dr. Samuel Siah. So for tonight's agenda, we're going to cover a few different topics. We're going to start with what is anxiety, and we're going to go into what are social anxiety disorders, when should you seek support, how do we treat social anxiety. Specifically, we're going to be focusing on cognitive behavior therapy as a treatment modality. What are some emotional regulation strategies you can use at home, and then a question and answer period at the end. Some general housekeeping pointers. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right-hand corner. You're listening using your computer speaker system by default. If you would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. If you have a question, you can submit them by typing your questions into the question pane of the control panel. You can also send them through the chat panel if that's easier for you. You can send a question at any time during the presentation. We will collect these and address them during the question and answer session at the end of today's presentation. Before we get started, we just want to share with you a bit about Morneau Chappelle and what we do. Morneau Chappelle is the world's largest provider of health, behavior, and productivity solutions, helping over 500,000 people each year through therapy, education, and coaching. Children's Support Solutions works with families, schools, and child care centers to identify children's needs and help them reach their potential. We work with infants to young adults of all abilities and ages and believe that each child is unique, and understanding that uniqueness is what we do best. We provide a wide range of services, including screening and assessment, one-on-one and group interventions, medical, legal, rehabilitation, and solutions for schools and daycares. Morneau Chappelle and Children's Support Solutions is family-centered and interprofessional, meaning we always start with the questions, what will work for this child and what's right for this specific family. We think about the mix of services that will help the child. In the Morneau Chappelle model, professionals are not just under one roof. We plan together, train together, and work together on client files. It's an integrated approach to helping the family. Our therapists and educators are trained and certified in a wide range of disciplines, including clinical psychology, speech-language pathology, physiotherapy, occupational therapy, behavior therapy, and special education. About our presenter this evening, Dr. Samuel Siah is a fully licensed child psychologist with Morneau Chappelle Children's Support Solutions. He specializes in several services for a wide variety of mental health concerns. He can conduct psychoeducational assessments, for example, learning disabilities and giftedness. He also does psychodiagnostic assessments for things like ADHD, anxiety, depression, and oppositional defiant disorder, as well as developmental assessments to test for things like autism spectrum disorder by running ADOS, as well as intellectual disability. He participates and runs individual psychotherapy from a cognitive behavior therapy, or CBT, as well as a mindfulness perspective for children and youth aged 6 to 18. He is actively engaged in video counseling, providing therapy services via webcam to adolescents across Ontario. Additionally, he has extensive experience with interdisciplinary supervision, consultation, innovation, and collaboration within a multidisciplinary team. He has also collaborated with school personnel. He is available to conduct workshops on a wide variety of mental health concerns, typically with other members of his team. Moreover, he is very involved in promoting our services to children, youth, and families through social media, for example, Twitter and chat, blog posts, video presentations, and webinars. I'm happy to introduce Dr. Samuel Siah.
Thanks, Samantha. So today we're going to be talking about social anxiety. And to talk about social anxiety, it's often helpful to kind of get a basis for what anxiety is in general. So when we think about anxiety, first of all, we think about fear. Fear is an immediate response to a dangerous stimulus. So in our evolutionary past, for example, we had lots of things that we could be afraid of, for example, tigers or other predators. When we encounter these stimuli, we have certain responses in our bodies and also in our thoughts or cognitive responses. Our body responses generally are part of our sympathetic nervous system. So these are hormonal changes like adrenaline, epinephrine, cortisol, things that run through our body and prepare us to either fight or flight. And when we experience these hormones, we tend to have certain symptoms like our muscles tend to get very tight. We tend to have increased heart rate, which promotes blood flow throughout the body, increased breathing rate to get more oxygen into the body, sweating. Some people have an upset stomach, for example, and that's just blood leaving the stomach area because we don't need to digest something when we're going to be eaten by a tiger. And more of these kind of body getting ready responses. We also tend to have thinking responses. So when we are afraid of something, we tend to become hyper-focused on whatever is causing us fear, right? So if the tiger is attacking us, we need to focus all our attention on a tiger and not anything else in our environment. Because we're hyper-focused, we oftentimes have difficulty thinking flexibly and generating alternative solutions in these situations. Because we need to act quickly, we need to decide on one course of action and go with it, fight, flight. We tend to also have an overwhelming need to escape from the situation as well, that flight response. And we tend to catastrophize things as well. Catastrophizing meaning we tend to blow things out of proportion when we're very afraid. So what is anxiety? Anxiety is anticipatory fear. That is fear about the future or worrying. So in modern day society, right, there aren't too many tigers around anymore, which we can become afraid of. But there's lots of things that can cause us anxiety if we think about them in the future. For example, presentations, work stress, bills, family stress, etc. So all anxiety has the same sort of biological basis. However, different people can have a different focus to their anxiety. And today we're going to talk about social anxiety, which is anxiety which is focusing on other people and potential evaluation in social situations. One thing to ask is anxiety always a bad thing? The answer is no. Anxiety is not always a bad thing. We have this fun Yerkes-Dodson curve here, and it's very simple. On one side we have performance, and on the bottom axis we have the amount of anxiety that you experience. So if our anxiety is too low, then we are not motivated to act, right? So that we can take an example of a student preparing for a test. If they're not worried about the test at all, they won't study, they might bomb the test. So we need a certain amount of anxiety to prepare us, to get us motivated to do something, to perform an act. However, once our anxiety becomes too high, that also impairs our ability to perform, right? So the Olympics just happened, for example. That's a prime example. If an athlete experiences too much anxiety before their event, their muscles might become too tight. It might impact their ability to perform that event. And also, once we start getting towards that high end too, we start to consider whether someone has an anxiety disorder. So, how do we know whether someone has an anxiety disorder, right? Lots of people experience anxiety. Lots of people experience some form of social anxiety as well. Lots of people are shy. Lots of people are hesitant meeting new people or speaking in public. In general, it becomes a disorder when there is dysfunction or when that anxiety interferes with that person's ability to function in important areas of life. So for a child, that might be socially, like making friends, might be academically, performing in school. It might be their ability to engage in the classroom. And it might be at home as well. Their anxiety might impair their ability to meet new people, meet relatives and things like that. Okay, so So there's lots of different anxiety disorders, but not all of them have the social anxiety component. So today we're going to focus on 4 disorders that do have a substantial social anxiety piece. Okay, and like I said before, all of them have the same kind of biological basis. It's just where we're focusing the anxiety that results in different kinds of disorders. So the social anxiety disorder, which is kind of the main focus, again, is on dealing with situations where you can be evaluated socially. Separation anxiety disorder, where the focus is on fearing separation from caregivers and care providers. Selective mutism, which is being able only to talk to certain people while being able to talk to other people easily. And generalized anxiety disorder, which is a disorder that covers a wide variety of different worries, but social anxiety can be part of that. Okay, so social anxiety disorder. Social anxiety disorder is intense fear or anxiety about social situations in which the individual is exposed to possible evaluation by others, and this has to last for 6 months or more in children. So some of these possible social situations could include social interactions with other people, like having a conversation, meeting new people. It could involve being observed, for example, eating or drinking in public, or some people, like when they're eating alone in a restaurant, they might feel very awkward. Performing in front of others, like giving a speech or presentation. And importantly, in children, this anxiety must occur with peers as well, not just with adults. The second criteria is the individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated. So this person feels that when they're in social situations, they might show some of their anxiety symptoms, like they might blush or tremble or sweat, or they might stumble over their words, or they might be caught staring at somebody, and this would lead to substantial embarrassment. And they might also believe that other people just judge them negatively. They might judge them as being boring or unlikable or anxious or crazy. The third criteria is that social situations almost always produce anxiety, which I think is pretty self-explanatory. But in children, that might look like freezing, clinging, shrinking, tantrums, crying, those kinds of things. And they try to avoid the situations, or they're endured with intense fear, and it's out of proportion to what the social situation actually is, right? So lots of people, as I said, experience anxiety about presenting in front of others, but if this person has such intense fear and anxiety that it's impairing their ability even to get up on stage, that would be out of proportion. It's pretty common, relatively speaking, for psychological disorders, and it's more prevalent in females than in males. So separation anxiety disorder is next. And this is excessive fear about separating from attachment figures. It's indicated by 3 of the following, lasting at least 4 weeks. So again, there needs to be some sort of a time criteria here. And these fears are also developmentally inappropriate, right? So we expect kids to have some separation anxiety as they develop, like when you're a toddler, for example. But we also expect them to kind of developmentally pass that phase. So some of these symptoms could include recurrent distress when anticipating or experiencing separation from attachment figures. That's just when you think something, you're going to be separating, you feel distress, or when you are separating. Excessive worry about losing or harm befalling attachment figures. These are kids who worry that their parents, if they go on an airplane, their plane will crash, or when they get in a car, they'll get in an accident, or they'll have some sort of illness or disaster that happens to them. Excessive worry about experiencing a negative event that causes separation from attachment figures. So this is something that's happening to themselves that will cause them to be separated from someone, like being kidnapped or getting lost or getting into an accident. There's reluctance or refusal to go outside of the home, to school, etc. Excessive fear of being alone or without attachment figures, reluctance to sleep away from home. So these are kids who refuse to have sleepovers or overnight camps, or need to have their touch figures nearby when they're falling asleep. And there's frequent nightmares involving separation. And then there's also kind of some physical symptoms involved when anticipating separation, like having headaches or stomach aches, nausea, or vomiting. So in school, this might look like a kid who always has a stomach ache, who's always going to see the school nurse, and not have any medical basis for it, and always requesting to contact their parents when they're at school. Okay. Selective mutism. So selective mutism is consistent failure to speak in specific social situations, like school, despite speaking in other situations that last at least 1 month. For example, a child might be able to speak at home with their parents, but not in school. A child may be able to speak to immediate family members, but not extended family members, like grandparents or cousins. And often there's a high level of social anxiety associated with that. This failure to speak results in interference with educational or occupational achievement or social communication. So you can imagine if a child doesn't want to speak in school, that would impair their academic performance and their ability to even evaluate how well they're doing academically, right? It could also impair the ability to work in groups or participate with other people or present in front of the class. Interestingly, like when you're younger, though, some kids can kind of compensate by communicating non-verbally, like playing tag or grunting or pointing. And the third one is important too. Failure to speak is not attributable to a lack of knowledge. So it's not because they don't know the language that they're not speaking. So selective mutism, generally the onset is before 5 years of age, but might not come to clinical attention until the child enters school and encounters difficulty. And there's some evidence to suggest that children kind of outgrow these symptoms over time, or specifically selective mutism symptoms decline over time, but social anxiety might remain in other forms. But it's relatively rare, between 0.3 and 1% prevalence. The last disorder we're going to talk about today is generalized anxiety disorder. And this is excessive anxiety and worry for at least 6 months about a number of different events and activities, and it's difficult to control this worry. And it's not, because it's generalized, it's not necessarily confined to social anxiety, but it's one of the areas that's very common within this disorder. You find it difficult to control this worry, and it's more than everyday worries because it interferes with their functioning. It's more pervasive, distressing, and it's accompanied by physical symptoms such as being restless, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. This one tends to be more prevalent as people age, so it tends to have the highest occurrence in middle age and declines later in life. But we do find a substantial segment of adolescents develop this disorder. Okay, so when should you seek help? So we see that a list here of common anxiety disorder symptoms, right? So we have crying, freezing, tantrums, failure to speak, those kinds of things, difficulty concentrating. But, many of these symptoms can occur for many different reasons or many different diagnoses, or just a lot of these symptoms are typical as well. So how do we know that it's an anxiety disorder, and which one is it? Well, as psychologists, we look again for a few key points. One is that, are these symptoms consistently happening in response to a particular social situation and not other situations? And we're looking at, are there lots of these symptoms, not just a few? And also, does it causing dysfunction or impairment in important areas of life? Okay, so how do psychologists help in general? So the first thing we do is what's called differential diagnosis, and that's exactly what I was talking about on the last slide, where we try and really tease apart which symptoms are the result of disorders, or which symptoms are not the result of disorders. as well as are there many different disorders involved or just one. So a psychologist can really assess your child to determine the presence or absence of these disorders. We can also help by therapy. There are many different forms of therapy. Today we'll be focusing on CBT, or cognitive behavioral therapy. But for social anxiety disorders especially, it's very important for the child to be comfortable with their psychologist or counselor, because talking to an adult may be one of the situations that are feared the most. It's part of social anxiety, often talking to strange adults. So in many cases, rapport is kind of the most important part of therapy. After the diagnosis and therapy, a psychologist might also consult with other professionals or other school personnel to ensure that there's kind of a generalization of skills in many different environments. Okay, so we're going to talk a little bit about CBT, or cognitive behavioral therapy, and it's one type of psychotherapeutic treatment that helps clients understand the thoughts and feelings that influence behavior. And CBT has plenty of evidence to support its effectiveness for several anxiety disorders. You can ask for references if you like. There are two main components to CBT. There's a cognitive and behavioral component. Unsurprisingly, this is known as cognitive behavioral therapy. The cognitive component is our thoughts about a particular event or situation, and the behavioral component is how we act or behave in a particular situation. And CBT is also refers to kind of testing out our thinking patterns in real world environments. So it's not just an intellectual exercise. There's also kind of a psychoeducational component as well. And psychoeducation just means informing clients about their diagnosis, kind of how we talked about anxiety earlier. So this is an example of the cognitive model that underlies CBT. And we'll go over it more in detail in the next slide as an example. But basically, what is happening here is that different situations cause us to have different thoughts and beliefs, which then influence our emotions and our behaviors. In CBT, our focus is usually on our thoughts and beliefs in a situation, because that can influence our feelings and ultimately how we act. And often we can't control the situations we find ourselves in, like kids have to go to school, or they have to give presentations or work with others. But we can control our thinking and how we manage that situation. So an example is here. So let's say we have a child with social anxiety and there's an upcoming presentation in class, and that's one of the most anxiety-provoking events that can happen for someone with social anxiety. So they can have several thoughts in this situation. For example, everyone's going to laugh at me, or that can lead to anxiety. And we usually have a good scale of 1 to 10, 10 being the most anxious, 1 being not anxious at all. It can result in different behaviors or outcomes, like having a stomach ache to avoid going on the upcoming presentation. But you can also have many other thoughts. For example, you could have positive thoughts, like the audience is going to learn a lot from this presentation, which might lead to excitement and might lead to preparation for the presentation itself. Or we could, for example, be frustrated that we have to go through this. Like, I can't believe I have to do this presentation and no one else does. It's so unfair. It might lead to feelings of being mad and acting out disruptive, being defiant in class. So CBT works again by focusing on the thoughts and the cognitions. So this is an example of an intervention that we might use to help a child in this scenario. So if an upcoming presentation results in a thought of everyone is going to laugh at me, one of the ways we can kind of challenge this thought is to ask, what's the evidence for and what's the evidence against this thought? So the evidence for it might be that maybe the last presentation they gave, one kid in his class laughed at him at one point in the presentation. So we would accept that as evidence that people might laugh at this child. But we can also look at the flip side, the evidence against. We can say that maybe this one kid kind of laughed at everyone's presentation, not just this one child. Or maybe it was only one kid who laughed, not the whole class. Or maybe we can point out that this kid has several friends who never laugh at him because they're nice people and they like this child. So after reviewing the evidence together in kind of a non-judgmental and accepting way, we can develop alternative thoughts to the first one. So when the child thinks everyone's going to laugh at me, we could think instead, just because one kid laughed doesn't mean everyone will laugh. My friends will support me. And after doing this kind of exercise in therapy, we can develop behavioral homework so the child can practice using this thought throughout the week. So we maybe set up some role play scenarios with parents or set up a presentation at home. We can give them a coping card to help them remember the steps we took. So what are some strategies you can use at home or at school? So because anxiety activates our sympathetic nervous system, as I said, those are all kind of body responses that activate it, we often need to calm our bodies down as part of our strategies to manage anxiety. So, for example, one of the things that happens is we might start to breathe shallower and more rapidly when we are anxious. So one way to combat that is to practice deep breathing techniques. And one of my colleagues is famous for her breathe in the cookie, breathe out the candle example. So you can practice this at home with you. If you like put your hand out and you imagine there's a freshly baked cookie on it, you breathe in through your nose, and then you imagine blowing out your birthday candles, breathing out through your mouth. And it's important to coach kids through this because we often say, breathe. And kids don't really know what that means in terms of breathing deeply. A lot of kids, for example, will just raise their shoulders up to their ears, and that won't result in kind of that diaphragm breathing that we need to help calm ourselves down. Another thing that happens is that our muscles get tense when we get anxious. So one way to combat that is called progressive muscle relaxation. And you can look these up on the internet. There's plenty of examples. But the concept here is that we kind of squeeze and relax all of our major muscle groups kind of in order. And kind of notice the difference between what it feels like when our muscles are tense versus what it feels like when our muscles are relaxed. One thing that is gaining a lot of research and a lot of traction in the psychological world is mindfulness and mindfulness meditation. So mindfulness, in a nutshell, is focusing on our present experiences using our five senses in a non-judgmental way. There's lots of different forms of mindfulness meditation, and for kids, it's often helpful to have a focus to the meditation. For example, walking or eating. So it's not just sitting and focusing on our breathing, because that's often challenging for kids. But again, we can look these up online. There's plenty of examples. Because a part of a child's social anxiety is often in the school, or a large part of it, it's often helpful to have a trusted person in the school who can help when the child is anxious and can prompt them to use these kinds of strategies. And this trusted person can be like a teacher, it could be a resource teacher or a social worker. And it's important that a child has someone in school so they don't have to call home and they don't have to feel like they have to miss school every time that they're anxious if there's someone in school that can support them. In classrooms as well, we can have kind of a corner of the classroom dedicated to emotion regulation, which might have different sensory activities, visuals for deep breathing or muscle relaxation, coloring stations, bean bag chairs, etc. Because children with social anxiety have difficulty with standard evaluations, oftentimes we might consider providing alternative evaluations for these children. So if, for example, they're nervous when taking tests, that other kids will finish before them, or that they're being judged, they might be benefit from being tested in a separate room. Or if they feel like they just can't present in front of the whole class, they might present first to the teacher so they can demonstrate their knowledge without having to kind of be overwhelmed by their anxiety.
So now we're at the stage of our presentation where we're going to take some questions. So I'm just going to open our window and see if any questions came through while Dr. Siah was presenting. What are the floating hearts? Okay, so the question that I have is, what are the floating hearts? I'm not quite sure what the floating hearts refer to. Potentially it was something earlier. I'm sorry, I'm not 100% sure what that is. We're trying to look through the presentation right now and see if we can locate that flying hearts, floating hearts.
Yeah, I don't see anything.
All right, if we find them, we will let you know. Does anyone else have any questions they want to be able to ask Dr. Siah? All right, I'm not seeing any more, so I think, oh, here's a good one. When does a child need medication? I think it's a great question.
Yeah, so that is a really good question. As a psychologist, I don't prescribe medication, so I can't really say what medications should be used or what are some indications or contraindications. But what I can say that is that when a child has tried therapeutic techniques, or when they've tried some of these emotion regulation strategies, and it doesn't seem to be working, it's still significantly impairing them, that's a good time to talk to your family doctor or child psychiatrist to see what kind of medications options are available to you. It never hurts to get a second opinion. It never hurts to get more information.
That was a great question. Thank you. Next question is, are there any specific tips for selective mutism?
Yeah, so selective mutism, as I said, tends to be something that kind of remits over time. But seeking, in this case, seeking a therapist is what I would suggest would be the best tip here, just because we need to kind of structure therapy so the child feels comfortable taking therapy one step at a time rather than kind of flooding them, like making them talk to somebody that they're not comfortable with. So a therapist can help you to kind of develop an individual program to kind of combat that.
Great question. Thank you. Next question is, do you have any strategies for children who are scared to sleep alone? This child does have a history of trauma and abuse.
That is also a great question. If a child has a history of trauma and abuse, again, seeking professional support would probably be the best way to go for the first, just because these symptoms that you're talking about might have deeper roots than just wanting to, sleep close to somebody. There might be, for example, something that happened to them in the past, which they might need to work through in order to kind of manage their sleep. And you can also kind of build in sleep routines as well. So having a consistent sleep routine every night can kind of be beneficial for sleep in general.
Thank you. That was a great question. Next one is, how do you help a child who does not believe they have anxiety issues?
Also a great question. So I guess this kind of depends on the age of the child. If a child is younger, for example, kind of in the earlier grades, they might confuse anxiety with other emotions. For example, a lot of children with anxiety might think that they're just it's just frustrating, the experience, or that they just don't want to do presentations rather than feeling anxious. So a lot of the times when kids come to work with me, I'll have to talk about what are the different types of emotions, and if they don't feel like they're anxious, we can kind of talk about other emotions that they do feel, like frustration or anger, and kind of manage those symptoms first, and kind of deal with anxiety in a kind of more roundabout way. And for older kids like teenagers, to be honest, I have not found a solution for that yet. A lot of the times they need to be willing to come in for help.
Great question. Next question is, can selective mutism be on and off throughout the day, even standing in the middle of a classroom and almost not responsive?
Generally, selective mutism is not on and off throughout the day. It's generally consistently a failure to speak in specific situations. So if you're in a class and you have selective mutism, you tend to not be able to speak throughout the entire day. But what might happen is that there might be one person, for example, that they don't want to speak in front of. So you might see a child like speaking with their peers in one situation, but every time the teacher comes around, the child will stop speaking. But there's usually a consistency to how they show their symptoms.
Next question is, can you speak to the overlap with anxiety in children who have autism?
Yes. So autism, there's kind of three main components to autism, right? There's kind of social difficulties, there's difficulties with communication and language, and then there are behavioral difficulties like sensory issues or repetitive restrictive behaviors. So the overlap here would be a lot of times kids with autism will show similar symptoms to kids with anxiety, in that they'll have difficulty talking to people, and they'll have difficulty kind of making friends with other people. But kind of the core difference between the two is that kids with anxiety actually have pretty good social skills. They just have difficulty implementing them in certain situations, whereas kids with autism tend to have poor social skills across the board. So they might not be able to make any friends, whereas a kid with social anxiety may be able to make one or two, but just have trouble developing new friendships.
Next question is, do you have any tips or strategies on helping and reassuring a child that their parents will come and pick them up?
So some strategies might be having some sort of token for you to remind the child of your presence. So a lot of the times kids with separation anxiety, they benefit from like having like a picture or something that they can hang on to. In terms of being picked up or coming to pick them up. So what you could do is, if a child like really needs to call you to be reassured, you can start by saying that you will speak to them for a little while, and then gradually increase the length of time that you between the child being able to call you. So for example, let's say you're coming in 20 minutes and the child calls you every 5 minutes. You can say, okay, I'm only going to talk to you every 10 minutes, and then I'm only going to talk to you every 15 minutes. So even if they call you, you kind of don't respond until the agreed upon time limit. And then gradually that could reduce the frequency of them interacting and needing to call you.
Next question is, how common is selective mutism in autism?
So selective mutism and autism tend to be quite different, in that selective mutism, again, you're able to speak. It's just certain situations that you cannot speak, right? So, or you're too anxious to speak. So, like I said, so you have actually pretty good language skills. You can demonstrate that with people you're comfortable with, but you might not be able to demonstrate it with people you're not comfortable with. Whereas autism, if a child is nonverbal and also has autism, they generally just don't have well-developed language skills at all. So that is kind of the reason why they're not talking. It's because they don't have language capacity, whereas a child with selective mutism does have language capacity.
Next question is, how do you know when and when not to push your child into new situations?
So that's a great question as well. And this is a situation where you kind of have to let the child take the lead. So one common therapeutic strategy is to develop what's called a fear hierarchy. And a fear hierarchy is when a child kind of ranks their fears from least anxious to most anxious. So for example, a child with difficulty giving presentation, their most anxious situation might be giving a presentation in front of the entire school, right? But the situation that's less anxiety-provoking for them might be giving your presentation in front of the class, and then below that might be giving a presentation in front of just their teacher, and below that in front of their parents, and below that just in front of like their sister or something. So what we can do is we can kind of ask the child about these different situations and rank them, and we can start on kind of the lowest rung, like what is just a little bit anxiety-provoking for that child. and ask them to try and go through that situation, and then slowly move up as they become more and more comfortable.
Next question is, I have a 16-year-old son who I suspect has generalized anxiety disorder. Any ideas on how I can convince him to talk to a psychologist or therapist? It is very difficult as a parent to get him to talk about how he's feeling.
So with teenagers and with youth, I often say it's kind of a try before you buy type of scenario. As I said before, kind of the most important part about therapy is for kids with anxiety is their relationship with their therapist. So I often tell parents, listen, like, just come in for one session. If you can convince your child to come in for one session, if they can get along with the therapist, great. If they don't get along with the therapist, well, then you gave it a shot. But just that one session to just see if you can build rapport with your therapist. And usually therapists are pretty good at building rapport and getting at least some buy-in that way. A lot of times, unfortunately, a child has to kind of reach rock bottom or experience symptoms that are impairing them, and they often need to seek help on their own. But if you can convince them for one session, that's often a good first step.
Okay, we're going to try to get through as many questions as possible. We only have a couple more minutes, so I'm going to try to get through the ones where it touched on something different that we haven't already talked about. There was one comment from an attendee who had mentioned that she currently is working with a client who speaks at home and doesn't speak at school, who's also diagnosed with autism. She indicated potentially that the client has selective mutism. So next question, and I guess this will be a little bit challenging to speak to, but we'll try. Is there any work being done within the school system or in New Brunswick to train teachers on how to deal with anxiety?
To be honest, I'm not sure about New Brunswick. Like, in terms of our agency ourselves, we do offer different organizational workshops and trainings for how to deal with anxiety, but I'm not sure about New Brunswick.
Next question is, how do you deal with your child who may not tell you what is bothering them? When asking them a question, the answer is, I don't know, and they shrug their shoulders. The child is between 7 and 10 years old.
So that's a great question. A lot of children have difficulty kind of verbalizing their emotions, especially when they're younger. They might not have the emotional vocabulary, or they might not know what are different feelings and how they differentiate from each other. So the first step is to kind of discuss all the different feelings, not just anxiety, happiness, anger, sadness, and kind of talk about how is that different in your body, how is that different in what you're thinking. So when a child has a good grasp on kind of those basic emotions, and they're still not wanting to talk about things, then often what's a good strategy is to either have some sort of book or some sort of indirect way of talking about it. So, for example, if a child is anxious, and you can find a book about anxiety and read through it, read about the characters, and ask them about what the child thinks about those characters' thoughts and feelings, and whether they relate to what the child is experiencing. Alternatively, you can also have the child kind of draw about their feelings. I find that's a great way to get some useful insight. Maybe draw a cartoon about what is it that's bothering them with thought bubbles, with speech bubbles, and with emotions to kind of get at what they're talking about without directly asking them.
Next question is, my son can present in front of the class but feels anxious in true social situations. He is 12 and had severe selective mutism when he was 4. Things have definitely improved, but it's in the social setting that's the issue. Should we be seeking help?
Yeah, so if kind of the main point there is if your child feels like, or you're noticing a child kind of is unable to make friends in general, and is having severe dysfunction in social settings, then that is a good time to seek help. And even if you're not sure, psychologists kind of, when we meet with parents, we hear this all the time. Like, we're not sure if our child is anxious, we're not sure if our child has a disorder, but we're noticing these things. And it's kind of the psychologist's job when they meet with parents to decide, hey, is this a disorder? Is this something that's very important, or is it just some kind of normative anxiety? So it's often, even if you're not sure, it's often helpful to seek help and to seek a professional opinion.
Next question is, should we encourage/force social interactions with peers?
Encourage, yes. Force, that's more of a tricky one. So we want to be able to put a child in a situation where they feel comfortable enough to interact. So for example, if a child has difficulty in large group settings, maybe setting up a situation where it's a smaller group setting, or setting up a situation where they don't have to have kind of an unstructured activity, but there's something that everyone can do that has well-defined rules and activity and scenarios like bowling, for example. Because all those things help a child to become more comfortable in the situation, especially a social situation, if they don't have to think about what to say or what to do, if it's kind of already pre-planned for them. So I would say, really, if you're going to try and push your child, do it in a way that is kind of the least anxiety-provoking to most anxiety-provoking.
Sorry, I think there's still quite a number of questions. We'll try to get to a couple more before time runs out. So there are quite a few questions about getting a copy of the presentation. One of our moderators has indicated in the bottom that we'll be sharing some of the meditation strategies as well as other online resources on our website shortly, along with the recording of the webinar, so you can have that information in the future. Next question is, with autism, can these social anxieties and behavioral issues be corrected or improved upon?
Yes, so a lot of times with autism, we do what's called social skills training, and that's really explicitly detailing what goes on in social interaction, and really helping them kind of learn these basic skills, like how do I have a conversation, how do I take turns in the conversation, how do I maintain eye contact, what's the appropriate distance to stand away from somebody, all these kinds of basic skills, so that they can improve those skills and hopefully develop more advanced skills as they get older. So there are several caveats to that too, right? Like a lot of kids with autism also have difficulties with like intellectual disabilities or with language. So a lot of that is dependent on kind of their base language skills and also their intellectual skills.
What strategies would you suggest for a mild case of social anxiety in larger groups only for a 5-year-old?
So I think it's just kind of similar to what I've talked about before, in that we kind of build to these large group settings with this 5-year-old. So maybe what's a large group setting for this 5-year-old? Like 4 people, 5 people, maybe start with 1 person and 2 people. Get them very comfortable in those situations and then build up to the 5th level. And all the while kind of teaching him emotion regulation strategies. So if he becomes more anxious, he can do some deep breathing, he can do some muscle relaxation, and kind of build up to those larger group settings.
All right, so I think this is going to be the last question as we're a little bit over time. If you ever have any more questions about your child specifically, anything that you want to know, please feel free to contact us on our website, through our Facebook page, via Twitter, or you can call us at 1-866-653-2397. Last question of the night is going to be, what are the benefits of a therapy dog for a child with anxiety issues?
So to be honest, I'm not too familiar with therapy dogs in general, but from what I've read, they tend to be effective in most cases of anxiety. Petting a pet seems to kind of reduce a lot of these autonomic body responses I was talking about before, heart rate, the measures of like skin conductance, sweating, things like that. So I think having a therapy dog can only help in these situations.
Thank you so much to Dr. Siah for presenting on social anxiety today. And as I said, if you have any questions for either Dr. Siah or any of our other clinicians, please feel free to contact us at our website, www.childrensupportsolutions.com, or by phone at 1-866-653-2397. Thank you all so much. Have a wonderful evening.